Okay, here we go. Okay, so then let's start with the event. I warmly welcome you again, you all on behalf of the Alliance. My name is Masha, and I'm here then with my dear colleague Anne-Christine. So the both of us, we will guide you through the not evening, morning, or afternoon, depending where you are. I will give you a few technical notes before we'll actually start. So you are welcome to use the chat. If you have questions, you can post it there. We will collect those questions during the presentation, and then we will answer them at the end of the presentation. Instead of posting your question, you can also just raise your hand at the end. But until the end of the presentation, please keep your microphones muted so that we can listen to the presentation. And then also we will post or give you the link for our website, for the Alliance website. If you want to learn more about the Alliance work, then feel free to visit our website. Yep, so that's it for so far. And I'm actually going to start with introducing the presentation, the event that we have now, and then also the speakers. So today we will hear something about Tanzania. So in 2020, Tanzania legalized the trade of game meat in an effort to curb illegal hunting, and then also to promote the utilization of natural resources and generate employment opportunities for local communities. This industry has developed rapidly and presented a number of risk management challenges in terms of legality, sustainability, and also safety. The presentation that is going to happen today, we will give some, we have some insights from the project that is funded by the Alliance. And we'll also hear some lessons learned, etc. And today we have two speakers. Please mute yourself. Thank you. We have two speakers. We have Daniel Mentele. He serves as a senior project manager for wildlife trade and One Health at Traffic's East Africa Program Office, and he leads the Traffic's team and delivering the GIZ funding activities on the program or the project, reducing risks in Tanzania's game meat industry, developing a One Health model for safe, sustainable, and legal supply. And our second speaker is Kudra Kangembe. He's the focal point for wild meat trade in Traffic's East Africa team. He's based in Arusha in northern Tanzania, and he works currently on the USAID-funded wildlife traps project implemented by Traffic and then also IUCN, and he ensures its links to the GIZ-funded project. So now you have a brief idea of who is giving the speech, and I will give the floor with further ado to those two speakers.
Thanks very much, Masha. I don't have to introduce myself again, but just shortly, my name is Kudra Kangembe, and I am based in Arusha. I'm happy to be here today to present the work that we have been doing here in Arusha. So just to give you an outline of what will be discussed today. So we're going to have a little bit background of the activities in Tanzania, but also what we actually did over the course of 2 to 3 years. We're going to learn a bit about the lessons learned and talk a bit about the recommendations and the next steps. So to give a little bit of a context on the game meat industry in Tanzania, it all began in 2019 when President Magufuli was in a political situation, giving a speech in a place called the Katavi region, and he mentioned something like, Tanzanians should benefit from their natural resources, which included eating and consuming game meat. So that was a kind of a directive to the responsible authorities here in Tanzania to kind of develop regulations that could allow now this to happen, which included formulating regulations that could allow the consumption of game meat. So the game meat selling regulations, which were established in 2020, allowed Tanzanians who were ready and who wanted to open the business to establish butchers, or I can say game meat selling facilities that would enable the selling and the consumption of game meat. But this also aligns well with the wildlife policy of Tanzania, which states that it is a right of indigenous Tanzanians to have legal access to wildlife use. So in that sense, this industry has been developed based on the currently legal framework here in Tanzania. So other than a presidential speech to allow the trade to happen, there were a number of reasons to why this scheme was established, including it was seen as a way to reduce poaching problem. There's a big problem with bush meat in the country, and so it was seen as one of the ways to reduce the problem of poaching. But also it could be used as an alternative source of protein to communities here in Tanzania. But also it could support employment opportunities and household income, but also support the communities, especially those living closer to protected areas, and especially those bearing the problems of living together with wildlife. On the other hand, it was being used as an alternative additional government income. So I don't know if I'm going very well with my slides here. They are not changing. Am I on the right slide, Masha?
Yeah, we still see the introduction slide.
Oh, okay, all right, thank you. Yeah, so what were the concerns? What were the concerns for the work in Tanzania, which looked at the game meat selling industry? When this project was had started, I think it was at the time when we had COVID-19. So it was paramount to investigate how wildlife trade could possibly contribute to spillovers, emergence and re-emergence of diseases. But also it was also important to understand the health risks that could be associated with trade in wildlife. But also, it was also important to understand that what does this trade bring about, for example, in terms of sustainability. So, what will be how will be the harvest of the wildlife population? What will be the sustainability aspect embedded within this kind of industry? But also looking at the compliance, how they establish regulations, how are they going to be enforced? What are other law enforcement that will probably help with the management of this kind of industry? So these three main areas or main concerns were the ones that were traffic actually initially was looking to, and prioritized in terms of how can we address these concerns. So the first thing was to we had an approach, we had a framework on how we are going to work in Tanzania. So firstly, when we started our work back in 2021, we had to get a government endorsement of our work, where we successfully collaborated with the Ministry of Natural Resources and Tourism through the Tanzania Wildlife Management Authority to work together to assess this industry and see what we can do in terms of best practices for management. So we got our permits to do this work, but also it was really important at the beginning to have a buy-in by the government so that the outputs of this project could be uptaken at the end, and that was a positive thing we had to achieve. So generally, our work was in at least 3 or 5 areas. The first was to do a kind of assessment, to do research, which included looking at what's happening on the ground. So, looking at the human animal interfaces, looking at the mapping of the supply chain itself. So also understanding the actors of this supply chain, the primary and the secondary actors. But we've also been looking at what are the capacities of the government in terms of supply chain management. What are their challenges in enforcement of laws and compliance, but also looking at what regulations are in place and where are the gaps. So we've kind of collected that evidence, and it has been helpful for us in creating maybe ways to try to manage the supply chain in terms of safety, sustainability, and legality. So we also invested in capacity building, which was to improve stakeholder accountability, but also capacity building to make sure that the industry is developed in a safe, legal, and sustainable direction. But we also invested much in disseminating the outcomes. Probably there are other geographies, with nationally or regionally that could benefit from the results and the evidence collected in Tanzania. So we presented this work in a number of platforms. But another component which is in line with this event today is behavior change. We also thought it is important to have a behavior change component in our work to be able to make sure that we are cutting across all areas that are needed for a safe and sustainable management of the game meat industry in Tanzania. So this is how the industry looks like. We're going to explain much as we go through this presentation. But in the meantime, the industry has around 3 main areas. So we have the processing area, so the processing node, where it involves the types of areas which have been identified by the regulation that as the sourcing points, but also processing, whether butchery or butchery processes and whatnot. But another node is the selling node. We've looked at what's happening at the selling node and what regulations are in place, what are the compliances, what are the challenges, and many others. With other processing areas within the supply chain, but we also looked at the consumption area. So this is how it is represented here in Tanzania, and I think as we move forward, we are going to unbox this supply chain. So our study was mainly focused at the northern part of the country. This northern part of the country is actually, we chosen this northern part of the country because of many factors. But one among those is that it is a place where there's high interaction of wildlife and human beings, and we have a number of communities in this area. For example, we have the Maasai, which is a prominent community in northern Tanzania. But we also have the Hadza community. So this is a kind of interesting community in Tanzania, because it is among the last gatherers and hunter tribes in Africa, with over around 1,300 tribe members. So this community actually depends on, they depend on hunting for meat and gathering, eating some root tubers and whatnot, and plants. So they do not do any sort of agriculture, nor they do keep livestock. So they depend on traditional ways of obtaining their meals. But also we looked at the urban dwellers, because most of these supply chains, whether legal or illegal in northern Tanzania, some of the meat ends up in urban settlement, and but also majority of the game meat selling facilities or the butchers that were established, half of them are in northern Tanzania, in the regions of Kilimanjaro, Arusha, and Manyara. So based on that, we used this northern Tanzania as a study site. But more than that, it composes majority of the protected areas, the national park. So it's a good destination for tourists, and therefore looking at the risk of spread beyond borders. So it's the probability if any issue happens, the probability of diseases maybe spreading all beyond the borders of Tanzania is high because of the larger concentration of tourists in northern Tanzania. So yeah, looking at the value chain analysis now and the disease risk analysis. So these were the two methods that we used to kind of gather evidence in this activity. So the value chain analysis was actually to look at the critical control points and understand what actions were happening at the critical control points. For example, what were the compliances at these critical control points, and how are the action at these critical control points contributing to issues of legality, safety, and sustainability. So that involved doing interviews with key stakeholders such as the wildlife management management authority officials, the wildlife, the district game officers, but also doing with a number of private stakeholders. So collecting that evidence through key informant interviews. But we also did a number of baseline surveys, such as we did some consumer surveys to understand the perceptions and attitude of the people who were consuming wild meat. But also we made some field observations, which included, visiting the butchers and looking at the butcher operations, also visiting areas where hunting was taking place, and looking at the processes that were involved in hunting. So those are the methods that we were used for collecting some of this evidence. But we went further and did some expert opinion workshops where we gathered a number of experts from different sectors, from the wildlife, from the public health, and the veterinary sectors, to kind of gather more information about these risks. And but also we did some sample collection, which we collected plasma and the tissue samples from wildlife that was being traded, from the meat in butchers, but also the wildlife in protected areas that were being hunted. But also we collected some data from seizures that were taking place here in northern Tanzania. So that was a kind of methodology used. But before moving further, I would like to explain a little bit about what are the sources of meat we are talking here in Tanzania. So currently, the regulations, they have identified around at least 4 or 5 areas where people who are involved in wildlife, in game meat selling could get their meat. One of the areas is resident hunting, so the local hunting, but another area is tourist hunting. So whenever a tourist goes for hunting and he or she gets the trophies, the surplus meat could be also used for selling, could be going to the game meat selling facilities. But also another area is wildlife farming, although we haven't started getting any supplies to the game meat selling facilities from wildlife farming. The current farm have existed for quite some time. I think they predated the game meat selling regulations. Another area is problem animal control. That when there's any problem animal control situation, if the animals that are part of that problem animal control situation are eligible for consumption under the Tanzanian laws, so that meat could also go to the butchers for sale. However, there have been a shift in how these areas are being used as a supply. So we've looked at the change, the decline in the amount of animals being sourced from resident hunting over time. And this is because of some of reforms in regulations to allow a sustainable harvest of these wildlife animals. But at some point, we have seen an increase in animals sourced from problem animal control. So in a sustainability perspective, it tells us a lot in terms, for example, does the business influence the number of animals that are being killed or that are being subjected to death because of problem animal control to supply to the butchers? So they are telling us in how enforcement can be aligned because of the change and the shift in trends in how meat is being sourced. So I will end up there. My colleague Daniel will explain a bit about the disease risk analysis process and how we're able to prioritize some of the zoonotic diseases here in Tanzania before we go to the findings. Karibu.
Yeah. Okay. Thank you, Kudra. As it has been explained, my name is Daniel Ndetele. I'm our project manager for this project. After having heard from Kudra, where he was trying to explain on the methodology we used, where we started by doing a value chain analysis, analyzing the players in the value chain, which include people, institution, processes which were carried out in the value chain, and the places to gather a number of information which we later used on the disease risk analysis. And on disease risk analysis, actually we utilized the conventional disease risk analysis, which normally is used in the animal disease risk analysis, where we had to first to describe the problem of which Kudra were trying to describe, and then at a later stage we had to identify the hazards, which we will see on later, based on the information we gathered from the expert opinion, interviews, and other players in the value chain. Then from there, we did a proper risk analysis, and in the process, we kept on communicating the risk to different players. And we then, at a later stage, we came up with risk mitigation measures, of which also we communicated to different players. Just as basic information regarding Tanzania, we have been experiencing number of zoonotic diseases within the country, and as well as all we know that almost all emerging diseases have been implicated with wildlife. Therefore, we thought that it is an area of working on it. So to start with, to identify the hazards, we gathered the experts from the public health, veterinary, and game officers all together, and then with them, they based on their the respective districts, they developed list of zoonotic diseases which are prevalent on their respective districts. Then at later stage, we leveraged all the between all the districts and came up with the list which is found on left-hand side, where anthrax, rabies, and brucellosis and leafy valley fever were considered as the more prioritized diseases on their respective districts. Then we tried to compare the list which we came up with the experts with the national prioritized zoonotic diseases, which they are almost similar. So we thought that now we are on the right track, because what our experts have identified and other information told us, especially on the literature review, and what has been prioritized by our national prioritization list is almost the same. Then, so we had to consider the number of diseases which were prioritized by our experts. However, we understood that there were other diseases which were not prioritized in this list simply because they have never experienced on their respective area. However, at any point, they have been happening or they may happen in the area. So we considered it as a less studied or unknown pathogens in our area. So after having the lists, then by using the conversional risk analysis methodology, then we estimated the probability of release of such diseases. Then after estimating the probability of release, then we consider the magnitude of the problem just in case if those diseases will appear. And then after having all those probabilities, then we consider the magnitude of consequence, the probability of disease occurrence, of which the probability of disease occurrence, we consider number of factors which were mentioned during our expert opinion meeting. So on that note, on anthrax, based on the magnitude of consequence, it was considered to be high, and probability of occurrence in area on the northern part of Tanzania was considered to be high. So the risk estimate was considered to be high, and for brucellosis, Rift Valley fever, and other pathogens which were not known at that particular time, but there is a chances of such a disease to occur because it has been reported somewhere else, where like it is shown on the slide. Then after going through all the information, we found that why we ended having such information, we realized that there was a mismatch in legislation and the mandate among responsible agents. That's why most of the information came out from that. It's like there were no connection between from the sourcing of the animals. There are no measures undertaken at the source till the meat gets to the selling facility. The regulation does not talk to each other on what to do when the animal is killed in the field, and how it is transported to the selling facility. What are the measures can be taken were not considered on both regulations, or in such a way that there were no existence even the guidelines and regulation for game meat inspection in place because of the mismatch of the legislation. As well, monitoring and surveillance systems for game meat does not exist under the current setup. Also, there were limited awareness of zoonotic disease among supply chain actors on the value chain. So based on all those information, we came to learn to identify the most critical points in the value chain. So we identified the critical points in the value chain and what can be done, and we had to move on informing different government agencies which are responsible on taking measures to limit or to reduce the risks of diseases, as well as sustainability and legality, the game meat trade. Then from there, my fellow Kudra can move on.
All right, thank you very much, Daniel. So as Daniel has mentioned that we've had a number of prioritized diseases that are possibly prominent in northern Tanzania, and through our study, we thought that we also looked. So, what are the probabilities of these diseases to enter the supply chain? But over the course of doing this work and the assessment, we realized that there is some of the initial the issues that happened at while the industry was being developed that could probably create that loophole for the disease transmission in this game meat selling industry. So one of the things, as Daniel mentioned, was a mismatch in the regulations and responsible agencies. For example, so the world meat supply chains and everything that deals with consumption of, for example, of meat, not wild meat, sorry, any consumption of meat in the country is under the Ministry of Livestock and Fisheries, which kind has all the necessary systems in place, like the traceability systems, the monitoring systems, the surveillance systems. But unfortunately, this industry was put under the Tanzania Wildlife Management Authority, a wildlife conservation agencies, which lacks this capacity, to do disease surveillance and monitoring, but also lacks this capacity to monitor the supply of meat for public consumption. So that was one of the challenges, the initial challenges that could potentially create health issues in this industry. The other thing is that there were no regulations in place at the first place, so we didn't have meat inspection regulations for game meat. So we have meat inspection regulations for the livestock and the domesticated animals, but we understand from a veterinary point of view that these guidelines cannot be adapted for wild animals. So lacking such kind of regulations meant that these animals were not well inspected, even if they were inspected, without the proper procedures for inspection. So such gaps in regulations had created challenges in making sure that the meat that is going for public consumption is safe. So it concludes that a reasonable amount of meat that has been consumed by the public over the past 2 years might not have been very safe because of lack of this kind of inspection. But the other things that we saw during the implementation of this work is that we had points that we call the critical control points. So one of the main critical control points was during sourcing. So currently, the modality of sourcing of wild animals is primarily involved in a wildlife setting. So everything comes from the wild. So we don't have wildlife farms or controlled animal breeding sites that supply meat to the game meat selling facilities or the selling points. So everything else comes from the wild. And at that point, the risks are much higher. The risk of transmission of zoonotic diseases, but also other foodborne diseases is always higher in that stage. But we also looked at what else is happening along the supply chain that could mean that probably the meat might not be safe for consumption. So we looked at the processing. So what are the processing? Where is the processing happening? We realized that the processing is also happening in the wild. The dressing of the animals also happens in the wild. And the setting where these animals are being butchered or skinned is not very conducive to maintain meat hygiene. But also at the point of sale, we also looked at some of the issues that are happening here that might create issues of safety. And we also learned that there's other actions that are happening at the selling point, especially on the awareness of how important inspection is and how important meat safety is taking into action. And possibly contributing to a number of ignorance of the current the regulations that are in place in a number of limited compliance on some of these health standards. So, as I was mentioning earlier in the earlier slide, that we learned that there is minimal compliance against meat safety requirements. So we tried to measure the number of compliance against, the number of butchers that were compliant to the regulations that were set. So, the game meat selling regulations have identified some of the areas, some of the requirements needed to operate a game meat selling facility. And we realized that majority of the healthy, safe meat safety requirements were not complied to. For example, we have the certificate of meat board that each butcher that is selling meat that has to have. We have a specialized meat van. Each butcher should have a meat van, but also each butcher should have a meat inspection certificate to understand that the meat was inspected. So we realized that majority of these requirements were not complied to. But other requirements, such as having a certificate to operate the business and certificate to deal with hunting and whatnot, were complied to 100%. And as you can see the pictures here, this is how everything is happening. So this guy here is preparing the meat in the wild, and then this meat is destined for the butcher for sale. So in this current setting, there is a probability of contaminating the meat, and probability of occurring of other, not only zoonotic diseases, but other foodborne diseases. The other thing that we're also looking into is the cold chain. So it's really tricky because the sourcing of the meat is happening in the wild. It is a wild setting. So when these hunters go to hunt, it is being looked as a game. So like sport hunting. So trophy hunting is more like a game and it's not all the time you can get an animal. So yeah, so these were some of the issues that we were looking at. The cold chain was not maintained, and probably the risk of diseases and other foodborne diseases was high across the supply chain. So we had other observed issues other than the healthy issues. Have other observed issues included that there's a high demand for meat among the communities in Tanzania. So some of the communities have, especially those in northern Tanzania, have been living with wildlife for quite a long time. Some are culturally tied to consumption of meat, so the demand for meat is really high. And but we also learned that there's limited capacity and resources, to allow a well-managed supply chains. Another big problem was research. In terms of sustainability, we learned that majority of the areas dedicated for wildlife harvesting in terms of hunting were not very much researched in terms of wildlife populations and the kind of species that are supplied in terms of of carrying capacity and other things. And the other issues were, there were, as we mentioned below, there were gaps in management of this supply chain between one agency and the other. And this was because there were no arrangement that were present in the beginning to make sure that there's a coordinated effort among agencies to make to manage this supply chain. Another big problem that we face here in Tanzania, and especially in northern Tanzania, is bushmeat. Bushmeat is one of the major threats facing biodiversity in Tanzania. And each year, tons and tons of bushmeat are being seized by law enforcement officers. So bushmeat is a big problem. And so what about bushmeat? So bushmeat was bushmeat consumption and wild meat and game meat consumption. The formalized game meat chain, they happen in the same area. So we also looked at it as a risk because of there's a possibility of this meat coming from poaching to go into the legal supply chain. So no matter how much you're going to manage the safety of these supply chains, if you are having meat coming from other supply chains, from informal supply chains and less managed supply chain, the risks of contaminating these other legal supply chains is also high. But bushmeat is also kind of having other implications in terms of sustainability and the legality of the game meat industry in the country. But on the other hand, the bushmeat, as I mentioned earlier, that the bushmeat problem could be solved if there were a good game meat trade and a well-managed game meat trade industry. And people would be advised, instead of going for poaching, they would be advised to go for the game meat, for the meat that has been well managed and that is coming from legally established sources. So we had so many those were the so many challenges that we realized when we were doing these assessments. But we also, in the due course, we didn't wait until we finalize the reporting and we complete the assessment. We started working to make sure that at least we reduce the risks that we have seen in this supply chain. But also we came to realize that wild meat supply chains like this need a multi-sectoral approach. So because it impacts both, wildlife, and it impacts both the public health and the veterinary health at one point. So only a multi-sectoral approach could be useful to reduce the impact, especially of diseases in this supply chain. So we tried to work with the district level frontline personnel at the district level, those who implement the regulations and laws, those who deal with first handling of problems, the first responders to issues. And we tried to cement their coordination to make sure that they can reduce the effect on the ground. But also we have tried to strengthen the capacity of how the supply chain is managed in Tanzania by engaging stakeholders at the national level. So we have worked with Tanzania Game Meat Selling Advisory Committee, which comprises of a number of representatives from different agencies, both wildlife, public health, and the veterinary agencies, and working with this committee has enabled us to influence the decision in terms on how best we could manage this supply chain can be managed. So we have contributed to at least some of the changes through working with the Game Meat Selling Advisory Committee, of which we are keeping on working with it until now. The other area that we thought it was really important is regulatory reforms. As you mentioned earlier, there were no quite explicit and regulations that were in place to make sure that the industry in Tanzania develops in a safe, sustainable, and legal manner. So we tried to influence the revision of some of these regulations and the adoption of new regulations if possible. So what we have managed to do is to try to work with the Ministry of Livestock and Fisheries to develop the meat inspection regulation that could possibly be able to allow the inspection of game meat that could capacitate the meat inspectors in the country to be able to proper inspect game meat to make sure that the meat that is being sold is safe. So other than these are just a few things that we have done a lot, but for the purpose of this event, these are just of the few. But going back to the topic today about behavior change, we thought it is really important to also include the social behavior change initiatives in this work. However, this part of the presentation, so the behavior change was not funded directly by GIZ. This work has been supported by other USAID-funded projects in East Africa. But we kindly we used the evidence collected from the assessment that were supported by GIZ to inform the behavioral change initiatives in this manner. So why did we have to include the social and behavior change in this work? Based on the experience from the surveys we did, wild meat is not an issue for most of the consumers, but also the managers of the supply chains. So people in Tanzania, the communities in Tanzania have been eating wild meat for quite some time. So if you talk about safety about wild meat, the majority of them will say, what is there to worry about? We haven't had any major diseases from consuming wild meat. We are eating wild meat most of the time. Even if you talk to the management authorities, for example, the wildlife officers, they have been doing trophy hunting, they eat the surplus. So they are not very worried about diseases. But we realize that is a behavior that has to change. That perception has to change, because it is important to learn that there are risks of these kind of diseases, and so it was also paramount important to have this kind of initiative in this work to make sure that it's also a multiplier effect to decrease the risk of diseases transmission in this industry. But maybe to explain more about this graph here, this graph here, it shows that the perceptions of most of consumers is that they believe game meat has no synthesized chemicals, the majority of it. So we did around 471 consumer surveys, and respondents, 471 respondents, and around almost half of them say that they consume wild meat or game meat, I can say, because it has no synthesized chemicals. So that's where they are driven to. And for the synthesized chemicals here, I mean issues such as vaccines or any other injection that this, whether it's keto or whether it's pigs they have. So this, in such situations, it was, it is important. We saw it was important to include this social behavior change aspect in our work, so as to change this kind of awareness. But now Tanzania had an opportunity of having two types of supply chains. So we have the formalized supply chains that has been established based on the regulations, the game meat selling regulations. The first one here, which is a bit complex supply chain because it involves multiple sources, it involves multiple processes and actions along it, and therefore it involves multiple actors. So we also looked at this in terms of behavior change messaging, and that behavior change in campaign or initiative should also take into account the chain, from the managers, from the sellers, traders, and the consumers. But we also had these shorter supply chains, especially the illegal or informal supply chains, which they only involve a poacher going to hunt and getting the meat to the nearby village for people to consume. So and in these supply chains have involved communities that the consumption of meat is really tied to tradition and culture in such a way that if you communicate issues of safety from diseases, it's the possibility of easy uptake is not high, because the consumption is tied to culture and beliefs. But for the longer supply chains, the most of these consumers are from people who have gone to school, people who have some kind of income, and therefore we learned that any social behavior change campaigns, which could be targeted, which could be lined with the possibilities of disease risk, where there was really taken very, very well. So as I mentioned in the previous slide, so our target groups for this purpose were the government personnel, to make sure that they change behaviors toward the perception, especially on the healthy part of it, to make sure the decisions are made in favor of understanding the risk associated with diseases. We also had women as another group, because women were responsible for cooking at home, and they also influence the kind of meal a household will consume of that day, and therefore we realize they can be a point of change in terms of consuming safe meat. But also traders, those that were involved in trading, in maybe the game meat selling operators, we also targeted them. So we have done a number of SBC messaging approaches. Some of them were radio talk shows, communicating some of the risk that are associated with diseases to the communities, especially here in northern Tanzania. We also made a number of posters that were for communities that were not able to have a fluent radio, to listen to radio fluently. We had a number of posters in these areas. We have done, we have created some of the champions, the risk messaging champions, who were able now to disseminate the messaging at different areas to different groups of people. And we also had some women groups that we kind of use also as champions, but we understand the role of women in making sure that the wildlife trade or the meat consumed is safe. Time has gone, and I have to conclude from here. But the key lessons we have learned overall is that it really needs a coordinated effort, and it really needs a multi-sectoral approach to be able to reduce these risks. But also, our work in Tanzania has been looked as bridging the gaps between different agencies, so that they could work together to make sure that the management of these supply chains are developing in a way that it's sustainable, safe, and legal. And so, as part of our work, we have kind of drawn a blueprint of how risk management could be, and this could probably be used in any supply chains within the same geographies here in the region, but any other supply chains that involve the wild meat consumption. It should consider all these aspects, supply chain management in terms of capacity, traceability, but also research component. It should also include behavior change component. As we have seen, behavior change is really important, but it needs a lot of policy work, policy revision, and policy formulation to make sure that everything is well managed and the risk of diseases are minimized. So that marks the end of my presentation. So these are some of the agencies and organizations that have supported this work in Tanzania. So to that, say thank you very much.
Yeah, thank you very much for the quite impressive presentation. Yeah, we have some clapping hands here. Thanks. Amazing. I think now everyone has pretty good idea of what is going on in Tanzania and how your work looks like. It's really impressive to see what you've done so far already. I will hand over to Anne-Christine to do the Q&A for now.
Yes, thank you, Kudra. Thank you, Daniel, also from my side for this very insightful presentation. I think it really shows the complexity as well of your work. And yes, we already have a few questions in the chat. Everyone feel free to post more questions, but I'm also happy if you just raise your hand and you can elaborate on your question as well, or just raise your hand and post your question directly. Feel free to do that as well. We can start maybe with the first question by Jim Siegel. Is there also an informal supply chain via street markets or person-to-person trade? If you want to elaborate on your question, feel free to unmute yourself, but otherwise, maybe you can already give an answer.
Come again, Anne, what was the question?
The question is there also an informal supply chain via street markets or person-to-person trade? So I don't know if you really want to elaborate more.
Okay. So you want me to answer, or he's going to elaborate more about that question?
Or maybe just share your thoughts on the question already, and then.
Yeah, so the informal supply chains, the illegal supply chains is mostly clandestine. It's not an open on display kind of trade. So it's illegal in nature, so yeah. So the only point that meat is legally allowed to be sold is the game meat selling facility that has received a license, that has been licensed to sell meat. The other kind of supply chains, or the illegal consumption, is happening illegally.
Okay, thank you. Then we can move on to the next question by Gustavo Monti. I don't know if you maybe want to unmute yourself, otherwise I can also read the question.
Yeah, no problem. Thank you. No, because you mentioned your presentation is a sustainable market. So my question was about what kind of regulation, or is there any plan on how to maintain the populations of the different sources in order to keep it available and not to create let's say, a side effect given the needs of overhunting, for instance, or things like that?
I'll go first, and my colleagues can jump it, Daniel and James. So in terms of sustainability, the risk is high. That's what we looked at. So the risk is high in terms of wildlife harvesting. And that's what we have also advocated to the government, that the risk of if this trade is not well managed in terms of how the populations are being harvested, the setting of hunting quotas, it's gonna create this risky. So we have engaged the government, especially through the Tanzania Wildlife Research Institute, TAWIRI, which is responsible for doing research to understand the population dynamics, to be part and parcel of the agencies that are responsible for overseeing this trade. And in that sense, they'll be able to make decisions based on evidence collected through research. And over the time, the government here is shifting in a direction that there are more wildlife farms established and more wildlife branches established to be used as an alternative source to the direct sourcing of hunting through tourist hunt, through resident hunting, which kind of picks animals directly from the wild.
Thank you.
Okay, thanks. Maybe before we continue looking at the questions in the chat, I also see a hand raised. So maybe you can unmute yourself and directly ask your question.
Yeah, my name is Ute Einberger. I have a question regarding, because you are talking about game meat here. Have you seen the risk in inspecting, or have you seen the risk with the trophies? Because trophies also carry the germs, and if they are taken out of the country, they have a great risk involved. The other comment I would like to make is that you propose that the bushmeat hunters would become legal hunters. I guess these are not the same sort of people. Normally bushmeat hunters, they hunt for subsistence and sell a little, while I guess the game meat hunter are probably more well off. And I think that would not be possible. But thank you very much for the presentation. I thought it was very interesting to hear your investigation about why the people eat the game meat. This is important data which has not often been collected.
Yeah, thank you for the addition. Actually, on our risk assessment, on the value chain, among the areas which we considered was trophy dealers, that harvesting the trophies also can be a source of spilling over the pathogen. So among the areas which we considered on the value chain are the trophy dealers. So it is one of the issues which can be involved in the transmission of the pathogens. Thank you.
Yeah, just to add on the bushmeat hunter or a game hunter, to define the two terms, bushmeat or game meat. So these terms are used interchangeably depending on the geographical area. But in Tanzania, so we consider game meat as meat from that is being sourced illegally, and bushmeat that the meat that is illegal. But when we speak of local hunters, so the local hunters, the resident hunters, these are legally hunters that are allowed to go and hunt, that have the permit and the license to go and hunt. So any product or any meat product coming out of the resident hunter or local hunter is considered legal to go into the supply chains. But we should not mix this with bushmeat, as from a poacher. We have this bushmeat problem, a poaching problem, that we have the informal supply chain. We have the consumption of bushmeat, which is not part of the formalized supply chain, that also could also enter at this supply chain at different places. But that is also seen as a risk, and something that the management of this the formal supply chain and the informal supply chain should go parallel, so that the impact can be well addressed. Yeah, thank you.
Yes, thank you very much.
Okay, thank you. Then we have another question in the chat by Flora Müller. I don't know if you want to unmute yourself, but this is a question concerning the problem animal control. But,
yeah.
Okay.
Yeah, I can just quickly elaborate, because you mentioned the various sources for legally sourced game meat, and you mentioned the problem animal control. And my question was, so they're using the meat generated from problem animal control, and they're selling them to the butcheries where they are dispersed to the population. Does this game also include endangered species? Elephants was just an example. So do they use elephant meat in the butcheries?
Actually, for elephants, no. So we have around four animals that are considered problem animals in Tanzania. So we have the buffalo, we have the elephant, we have hippo is among but among those four groups, it is only the hippo and the buffalo that are allowed to go into the supply chain. So we are not talking about the elephant and other big cats that could be part of problem animal. And yeah, so that's where the difference is. Yeah, I hope I've answered your question.
Yes, thank you.
Okay, thank you. Then we have another raised hand by Ricardo Orusa. Maybe you want to unmute yourself and pose your question.
Yes, thank you. Firstly, Kudra, best compliments on your strengths and points. Very, very, very interesting. But my question is very simple. Which biosecurity approach you have and use regarding that? Because biosecurity, in any case, is absolutely important point. I see in your presentation this status, but if you can explain that, thank you.
My colleague Daniel will respond to that.
Yeah, if I got well your question, yes. On our study, we learned that there are a number of measures which were lacking, of which it could protect community just in case of presence of pathogens coming from these wild animals to community as a meat. One of the issue which we learned was under normal circumstances, the animals are supposed to be inspected even before killed, but with the wildlife, it looked like it is impossible. But important, it was at least once the animal is killed, before doing anything, it is inspected to see that is at least by looking into the body condition and other features, it's good. And after that, then after processing, opening it up and having the meat, also the meat is inspected to look into different kind of tissues and whether there are some lesions which could be pathological changes. So among the things which we actually advised, or the government institution, especially the veterinary service, which is responsible now on the inspection of meat, is to consider is to develop the standard operating procedure for different species and coming up with the training for meat inspectors, because the meat inspectors were not used to inspect wild animals. They are used to inspect different species of domestic animals, and probably come up with the mechanism of disposing the waste from the wild animal leftovers or condemned parts or the whole bodies. So that's what we have advised and considered after doing our work. Thank you.
Thank you so much.
Okay, thank you. We have more questions in the chat. So another one by Jim Siegel. Do game animals carry COVID in Tanzania? In North America, white-tailed deer, the most common cervid, now carry COVID from contact with human wastewater. Have you found any COVID in game animals?
Actually, based on the information which we gathered from our experts, there are no COVID. However, we have some samples of which now they're in the lab. Probably on the samples we may have something like that, but based on the information from the experts, the public health officials and veterinary officers, as well as the game officers, we haven't had experience. They have never experienced such cases on the wild or domestic animals as well. Thank you.
Yeah, just to add on that, Annie, I think so when we started doing this work, we anticipated that we are not going to get the major, these pathogens, especially from the viruses, the coronaviruses and whatnot. Northern part of Tanzania has some zoonotic diseases, but the main ones are the anthrax, and so the main thing was maybe to look at even the other risks that could be posed by this kind of supply chain, instead of such as the other foodborne diseases, bacterial diseases and whatnot. So so our communities here don't consume the high risk taxers, for example, the primates and whatnot. So we knew that we're going to be looking at a different set of pathogens but also more like how the meat quality and meat safety was one of the aspects we were kind of looking into. Yeah, thanks.
Okay, thank you. As the event is ending in already 5 minutes, I'm not sure if we can go through all the remaining questions, but maybe we can collect them and then maybe answer them in a written form and upload them in the members area so that everyone can still maybe look up the answers to their questions. After my colleague Masha also posted some feedback questions in the chat that we would really appreciate if you could respond to them before everyone has to leave. But as we still have 4 minutes, we're just gonna maybe choose 2 more questions to be answered. So the next one is by Kolve Luvamya. I don't know if you maybe want to unmute yourself and ask the question directly. Otherwise, I can also read it. Did you consider the economic parameters in the value chain analysis? For example, the cost of producing 1 kilogram of game meat.
Yeah, so we did a cost and benefit analysis, and we looked at that. That was one of the areas we looked at, and this is because it is really important to understand the drivers for trade and what incentives the government will have in terms of managing that supply chain, or what incentives do the traders get from doing this business. So we looked at the investment, for example, a game meat operator could make to obtain an animal and the profit that he or she could have at the end. So those are the kind of areas that we looked at. But I think we are producing a really nice report out of this study, and probably if all goes well, it will be online for to have some more insight about the in-depth of the work we've done. Thank you.
Then we also have a more technical question by Ekta Patel. Also another invitation to unmute yourself, of course. Otherwise, I will read it again. Have you tested bushmeat samples for pathogens? And if so, what molecular tools were used?
Thank you. Actually, with the samples we have, we intend to first to extract the 16S RNA in all the samples. So for those which will have a 16S RNA will be now subjected to a specific sequence now to know specific pathogens, specific bacteria. And for the viruses, which we have prioritized, will go directly to sequence with the specific primers of those viruses. And actually, it is only one virus, the Rift Valley fever virus. Thank you.
Thank you. Okay, as it's almost 1:15, yeah, we will collect maybe also the rest of the questions, and hopefully, if that is okay, answer them in a written way. And then also we will ask you guys if we can maybe share the presentation. But if that would be the case, then of course you can find it in the members area. But for now, I also just want to thank all of you for attending, and also to you again, Kudra and Daniel, for presenting. Sorry we couldn't answer all the questions, but as I said, hopefully we can still do a follow-up. So yeah, thank you everyone. Thank you to our presenters and the team. It was very nice, and yeah, keep updated on our upcoming Voices from the Ground events that are going to happen the next year in January and in February. We'll also have an onboarding event, and yeah, until then, I already wish you good holidays, and yeah, good to see you, and hopefully see you next time. Bye-bye, and thank you.
Bye-bye. Thank you.
Thank you.
Bye-bye. Thank you so much. Bye-bye.
Yeah.
Okay.
Bye-bye. Thank you.
Bye-bye, Masha, and all of you. Bye-bye. Ciao.
Bye-bye. Nice to see you. Bye. See you next time.
Thank you. Ciao. See you later. Ciao. Ciao.